Good evening, everybody, and welcome to another weekly wellness workshop. My name is Dr. Hailey, and my husband, Dr. Ryan Hyde, and I are the owners and chiropractors at Glacier Family Chiropractic and Wellness in Columbia Falls, Montana. And we are on a mission to empower you to thrive through teaching you and helping you understand what it means to truly be healthy and happy. Furthermore, we not only want to educate you and empower you with information, but we also want to provoke you to take action regarding your health now, rather than waiting for dysfunction and dis-ease to arise, like unfortunately many people choose to do. This week's topic is Love Your Spine, daily tips to take care of your neck and your back. And the question is, why should you love your spine? Why should you preventatively take care of your back and of your neck, even if those areas don't hurt? That's what we're going to talk about tonight. So, diving into it, if we really stop to think about it, why do you need to take care of your spine? And I have a really simple and basic question, and that is, have you heard of a spine transplant? Because I haven't. If you have, please let me know. I will take it back. Always open to new information, but the reality is that spine transplants don't exist. We acknowledge that in order to have healthy teeth, we have to brush our teeth twice a day and we have to floss. We need to have routine visits to the dentist. We acknowledge that in order to have happy and healthy skin and hair and nails, we need to bathe ourselves and we need to use certain kinds of soaps. But why is it such a foreign concept for us to take care of our spines? Why is it so taboo to prioritize spinal hygiene? The reality is that your spine houses and protects your central nervous system just like armor. Your spine houses and protects the singular organ system that controls literally every single function, every movement, and every other organ system in your body. For moments, you could exist without, oxygen or food or water for certain periods of time. But the second that nerve impulses cut off, life ceases to exist. We need to have those nerve impulses. Now, while caring for your spine on a regular basis isn't as dramatic as your nerve impulses being turned 100% off, what we must consider are the smaller percentages of stress that are placed on our spines and on our nervous systems on a regular basis, and how that impacts our health and our well-being in the long run. And that's what we're going to talk about tonight. So ultimately, what we need to understand is that our spine and our nervous system are, two in the same, or not two in the same rather, but our spine houses and protects our nervous system. The health of our spine impacts the health of our nervous system, and that nervous system controls everything within the body. So what can we do on a regular basis to take care of these structures? Now, if you're a patient of ours and you're watching this, I'm going to sound like a broken record, but we are going to talk about sleeping posture. Most people will acknowledge that, our daily habits or our posture in general contributes to back and neck issues, but we don't tend to consider how our sleeping position factors into the health of our spine and the health of these structures. So sleeping position is really important. We spend roughly a third of our time sleeping, so how we do so is really important. And I'm going to give you just a few basic but really important tips here. First and foremost, you don't want to sleep on your stomach. Now, I feel for you if you are a stomach sleeper, but sleeping on your stomach is one of the worst things you could do for your spinal health. It flattens out your curves, it puts a lot more pressure on your discs, and it causes all sorts of muscular aches and imbalances. Now, we don't want you to sleep on your stomach. Ideal position would be to sleep on your back with a good ergonomic pillow underneath your head, so making sure you have proper neck support, and then with a pillow or two underneath your knees. That way there's a light bend in your knees and it takes pressure off the low back. So this is a great position for sleeping if this is something you are able to do. But for many people, making the transition from stomach sleeping to back sleeping can be really difficult, and this is where side sleeping comes in. So there are some ways that you can side sleep and still have a nice neutral spine. just as we discussed with back sleeping, regardless of what position you're in, we want to make sure that you have a good ergonomic pillow that's giving you proper neck and shoulder support when you're sleeping. Now, to help keep the rest of your spine neutral, I really recommend a nice, fluffy, long body pillow if you're able to, because ideally we want pillows that you can wrap your arms around. We want something that you can put between your knees, but then also something that's going to reach between your ankles. This just keeps your spine neutral, and this takes pressure off of your joints. Next tip we're going to discuss is living an active lifestyle, and living an active lifestyle is essential for all aspects of mental and physical health. If you're sedentary, if you're not an active individual, if you spend a lot of time sitting on your couch, this can lead to all sorts of health issues, weight gain, and joint problems, just being the tip of the iceberg. Living an active lifestyle doesn't mean that you have to sign up for CrossFit or you need to be going to Orange Theory classes or anything expensive or elaborate like that. Now, those things can be really great resources, but if that overwhelms you, don't fear. Even just doing things like going on walks are really great ways to live an active lifestyle. Doing things like parking further out in the parking lot, so you have to walk longer to go into the store. Walking around for little trips in town that you don't necessarily need to drive for. Doing things around your house, working on projects in the yard, meeting up with people, doing stuff outdoors. All of these things promote an active lifestyle. I would tilt my camera down right now, but our stand's broken, so I'm worried it would fall over if I did so. But we've got dogs here, and dogs are a great way to live an active lifestyle, or small kids, because they force you to get out and move your body. So if you want to have a healthy neck, back, and spine, you have to be active. You cannot be a couch potato. Next point we're going to discuss is hydration. In order to have a healthy spine, you need to make sure that you're hydrated. Now, the discs that are in your spine between each vertebral level throughout your entire neck and back, each of those discs functions to absorb shock and also allow for movement throughout your spine. Your discs are made of up to 80 to 85% water, so making sure you're staying hydrated supports healthy disc tissue, and you do not want disc issues. But also proper hydration is just important for really any aspect of physical well-being. So must stay hydrated. A couple of tidbits I would say is make sure you always bring a water bottle with you. When I just bring a water bottle with me everywhere now, but once I made that change in my lifestyle, I was instantly able to drink so much more water. And a general rule of thumb for water intake is half your body weight. So take whatever number you are in pounds, half that number, and that number, but in ounces, is what you want to strive for within a day. But of course, discuss this with your doctor if you're looking for more specific recommendations. In addition to hydration and movement and being an active individual, you have to avoid highly processed foods, fast foods, things with excess sugars. Again, this is some stuff that can seem like a broken record, but these are the foundation of health, what you put into your body, what you do with your body. So you want to strive to make most of your meals at home and with basic whole food ingredients. You want lean meat, quality beef, good quality fish, fruits, vegetables, nuts, legumes. You want to consume more of those things and really limit your intake of white breads, pastas, cereals, candies, things along those lines. A great tip when it comes to eating healthier foods is if you flip the food over and read the ingredient label and you can't pronounce what's on that label, or there's a long list of ingredients, or there's dyes in it, or high fructose corn syrup, or lots of things you want to avoid. But if you're seeing sketchy ingredients on there, things that you don't understand, or just too many ingredients, period, put it down. You don't need it. Also just watch for sneaky sugars. So look for sugar. I mean, there's sugar in things like bacon and breads and pastas, even things you wouldn't think about. You also want to pay attention to the amount of sugar in your daily cup of coffee or whatever your comfort drink of choice is. Keep alcohol in mind. That can lead to all sorts of inflammation and issues as well. So what you eat, what you put into your body, and how you hydrate your body really impacts how your neck and back feel, but also how your spine functions. Excuse me. All right. Few more things we are going to discuss here in the topic of loving your spine and caring for your neck and back on a daily basis. In order to take care of these structures, we need to make sure that we have a nice, strong core and we have mobile joints and we have a balance of stability and flexibility throughout our body. So in order for that to happen, we need to be, number one, active. Number two, we do need to focus on integrating strength and mobility when it comes to our exercise routines. When it comes to strength training, you don't have to overcomplicate it. Things like weightlifting or resistance training are amazing. Pilates, there are some studios that do the reformer machines. Those are a great way to strengthen your body. Bar classes, swimming, but even just going on walks is a great way to support an overall healthy body, healthy, strong body, excuse me. In discussion with spinal mobility and core strengthening, this is a topic I'm going to dive into more depth in a couple of weeks here. So join us in 2 weeks and we'll be talking about different things you can do to improve the mobility of your spine and joints, as well as strengthen your core in a way that protects your low back. In addition to strengthening your body and focusing on mobility, you really want to be conscious of tech neck. And I bring this up because a lot of people nowadays are dealing with tech neck. Tech neck can cause headaches, migraines, jaw pain, shoulder pain, breathing issues, anxiety, all sorts of biomechanical issues, physiological issues. And a majority of the patients we see are dealing with some degree of tech neck. And what's kind of scary is that some of the most severe cases of tech neck we see are actually in our youth and in our younger generations. And that's just because there's been such a rise in technology and dependency on technology within the last 5 to 10 plus years. But the reality is, anybody of any age is susceptible to tech neck, and sometimes it's not even tech that's causing tech neck. Anything that has you rounding forward, bending forward, looking down, all of those things contribute to tech neck. So this is something I really recommend learning more about. Next week, Dr. Ryan will be diving into tech neck for our weekly wellness workshop. If you're local to Columbia Falls or the Flathead Valley, we are also doing a luncheon where we're going to dive in depth not only about what tech neck is, but how you can look for tech neck in yourself and those around you. And then also just some other really great tips too. So if you want to join us for that and dive in really deep to tech neck, that is the Columbia Falls Chamber Luncheon at the Cedar Creek Lodge in Columbia Falls, 11:30 to 1. We'd love to see you there. But you need to be aware of tech neck and how to maintain your curvature within your neck and how to support a healthy spine and healthy muscles when it comes to tech neck. A couple more things here before we wrap up tonight's workshop, but in discussion of loving your spine and protecting the integrity of your joints and your back, we need to discuss daily ergonomics, day-to-day tasks, your hobbies, your postural habits, all of those things you really want to dive into with a chiropractor. Now, if you're not a patient of ours, if you're not local to the area, let us know. We would love to help you find a chiropractor within your area. But if you work with a chiropractor and you can talk about, the specific demands that are placed on your body on a routine basis, it will help us to give you more tailored advice and what you can do to improve your work ergonomics or balance out whatever kind of stressor you're dealing with in that situation. Because truly, we cannot discuss spinal health without discussing the importance of chiropractic care. There are 2 areas of healthcare that are going to work with your spine directly, and that is chiropractic care, working on the outside of your body, and then surgery, which is working on the inside of your body. If you know that taking care of your spine is not optional, because as we mentioned earlier, if you have a spine, you have to take care of it. We take care of our teeth, our hair, our skin, our body overall. We need to be taking care of our spine as well. So if you know this and you know that it's not optional, you can either make the choice now to care for your spine, or if you don't make the decision to care for your spine, it's likely that at some point you will be forced to care for your spine, whether you're dealing with debilitating symptoms or neurological symptoms, or things aren't functioning well within your body or moving well. You may hit a point where you are in a surgeon's office or you're in your medical doctor's office and you're seeking out steroid injections or potentially addictive medications to help you deal with these issues. So while many people still view chiropractic as non-essential to a regular healthcare routine, we need to understand that chiropractic care, when performed by a board-certified and licensed chiropractor like myself and Dr. Ryan, when you are getting chiropractic care done by an actual chiropractor, it's not only safe, but it's also effective when it comes to maintaining good spinal hygiene and preventing back and neck issues from ever arising. The reality is that chiropractic care is non-invasive, it's very low risk, and it's highly unlikely that you're going to experience any side effects of chiropractic care beyond maybe some soreness or a little bit of achiness, especially when you first get started in care. But the average patient feels great after they get adjusted on a routine basis. And this isn't to shade medicine or surgery, because there absolutely is a time and a place for it, but we do need to acknowledge that these things are invasive. They're either cutting into our body or adding, non-natural things into our body to help it function better. There's a time and a place for these things, but ultimately chiropractic care is much safer and much more efficient in helping with these issues. So as we wrap up this week's workshop, I want to ask you, why are you not caring for your spine? It either comes down to simply you don't know how to, which now that you've listened to this workshop, hopefully that's something you can say differently, or now you know about it and you're choosing not to do anything about it. So ultimately, I just want to prompt you to reflect on that decision that you make for yourself. Taking care of your spine is not optional. You can either do it now or be forced to do it later down the road when you are potentially facing more serious circumstances. So that is all we have for you today. We hope you learned something new from that, and we hope you will continue to expand your knowledge of healthy habits and ways to take care of yourself with next week's workshop and the ones after that. So we'll see you then. Thanks.